Well, good morning. I think we'll get started. I've never stood before 3 computers at a podium. I want to thank the staff of the National Cancer Policy Forum for, again, giving us a great breakfast and setting up a great meeting. This is our summit. We meet every 3 years, roughly, to pick the projects that we're going to study. And the goal is to pick projects in which policy can be changed and action can be taken. So this isn't shots at the moon. This is things where we can try to affect current policy issues that could be in research, patient care, prevention, public health, infrastructure, anything to do with cancer. And I'll just remind you, I'm sure you're aware that the work we do does have an impact. The report that we put out in 2010, the National Cancer Clinical Trials Program, had a major impact, shining a very bright light on the inefficiencies of our clinical trial system, and there's been tremendous change that's occurred. Another report, Evolution of Translational Omics in 2012, looked at how we would standardize genomic analysis of patient specimens, and led to a checklist, actually, which was published in Nature this past week that I think will be very informative for everyone. We have a report on reducing tobacco-related cancer that came out in 2013, which brought us up to date on the methods of prevention and also the different forms of therapy that can be given to patients. And of course, we're coming out now in next month with a report called Delivering High-Quality Cancer Care 2013. It's a follow-up of the report in 1999, which had a huge impact. And this, like many of our reports, is resulting in publications. There'll be one in the JCO, the JNCI, and the Journal of Oncology Practice, as well as the famous journal, the New York Times. So we are able to get the word out. I want to thank everyone who's come today to give us your opinions on what and why we should do it, what we should have workshops and consensus reports on that might affect policy and make it easier and more facile for us to affect this awful disease we work at together. And now I'll turn the morning session over to Fred Applebaum, who will be chairing the first session. Thank you.